morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk today is anxiety and depression among our school and college students. Joining us today on my health talk as guest speaker is Dr. Kingsley Thomas. He is the Vice Chief of Pediatrics at St. Joe, Oakland, and Katrina Sanchez, and she is a clinical nurse practitioner. Both of them are going to highlight our viewers about how do you handle these cases when from the pediatrics perspective. So, good morning, Dr. Thomas. Will you please just give some introduction to our viewers? You can look at me.
Yes. Someone suggested that in life, opportunity favors the trained mind. And I must give thanks to all those who have helped me in the field of pediatrics and teaching me the basic principles of anxiety. In this time when COVID was rampant, I've seen more patients with the symptoms of anxiety than I've ever seen it before. So we would consider anxiety a behavioral pattern where people become scared of many things. Some of them are physically and some are mentally. The anxiety produces a lot of complications in the lives of these kids. In the time of COVID, most of these kids were out of school. They were in homes, and a big percentage of the homes had dysfunctionality, meaning they were divorced.
Right.
And we see that divorce and family issues create a lot of problems in the lives of the young patients. We see that they're scared, they're on all that they do, they no longer have social behavior, interactions with other colleagues, and so they are left at home. And what they see at home is reflection in their behavior. And so a great percentage of these kids will have anxiety, and it's manifested in the form of stress.
So just to make a story short, we all have anxiety, right? And
Yes.
we all have stress. But it's just that immature brain is unable to handle that, right?
Yes.
We have experience, we are able to. But these kids, they are school age kids and they are going to college. It's hard for them to handle it, and then they go into other way. Do you have anything to add to this, Katrina?
The prevalence of anxiety in kids now, it's 5.6 million kids affected with anxiety.
I went through that, through a statistic, how much more it is, Okay.
And with the depression, there's 2.4 million child and adolescents affected, and only 80% go for treatment.
So doctor, what are the forms they manifest, like obesity, and other forms? How they manifest before they come to you?
They manifest with overeating.
Right. Yeah.
They're withdrawn. Their social behavior is completely different from kids who are without anxiety. However, we see that patients who have, the kids who have anxiety, they are placed in an environment where the parents are not able or have not the knowledge of taking care of these patients. And so it's profound that they become more anxious than ever, because a lot of people in the society think that anxiety or any psychopathology, they look on it as if they do not want other people to know about it. And so these patients are not taken to the physician. For example, if someone has a cold, they would run to see the doctor.
Right.
If they're anxious, if they're not doing well in school, the parents would reluctant in letting other people know about it.
And
So it's the job of the
job
pediatrician.
of the pediatrician before when they come to the office. And I have, during my clinical pediatric, I have noticed they come with bullying,
Bullying.
fighting with the others, and so many eating disorder, you said, with all those underlying diseases leading to this. And most important thing is, I believe, falling at a school grade, right, Don?
Yes, there's and a lot of those people with anxiety has a high incidence of ADHD.
Right. Yeah, I was going to ask you about
And
that.
you know that the ADHD has three main features: impulsivity, hyperactivity, and
Right.
poor attention span. But you mentioned about obesity. Yes, because they eat a lot. And we know that obese patients have a lot of psychopathology. In fact, there are studies which suggest that they have a high incidence of car accidents because they refuse to wear their seat belts.
Seatbelt.
So these are a lot of things. They are withdrawn, and then beside of their obesity, they turn toward other things,
Other things.
including drugs.
Do you have, Katrina, do you have anything to add with all this?
Just with the anxiety and the depression among the child and adults, like the prevalence of it is just very high because I work in patient psych before, and it's all aside from those factors that Dr. Thomas mentioned. Social media does play a huge role.
Very well.
And yes, and like usage of devices and the internet, it plays a huge role in anxiety
Yeah.
and depression.
So, question for you, doctor. When this patient go to your pediatrics office, what do they expect?
Well, a lot of times you'll ask them why are they there.
Okay.
They would say they don't know, even at an age when an appropriate age when patients should know why they're there. And you see some reluctancy of speaking, reluctancy of removing their coat for weight.
Yeah.
And you ask them to sit on the table, and they would stand and would stare you in the face. So you as a pediatrician has to say, listen, the only reason I'm here is to help you. And let's
Right.
cooperate. Let's do the things that will make your life a better.
Right.
And talk to the parent and say, you are the mother. Could you help me with your son or your daughter? And so when they sit on the table, first thing you tell them that I'm here, I'm going to put my hand on you, because a lot of these kids have been physically and sexually abused.
Exactly.
And they
Yes.
do not want to be touched. So
Exactly.
everything that you're going to do, you're telling them, I'm going to put my hands here, I'm
Right.
going to do this, and all I'm trying to do is to help you.
So that's good. So initially, mother and the kids are together.
Yes.
But later on, after you do a physical examination, then after that, you want to, because
Well-
it's hard for them to talk about your private issues.
Well, yes, I
Then the
will.
mother waits outside. Right?
I will ask them, I let them make that decision.
Okay.
I said, would you like your mom to be here? And whatever decision they make, I follow that decision.
Okay. Okay. So we are going through this physical examination. The first of all we want to rule out if there is any underlying causes, right?
Yes,
Like
because we know
diabetes, high blood pressure,
hypertension,
thyroid issue, yeah,
and especially thyroid disease,
thyroid disease, yeah,
and a usage of drugs
drugs,
and
yeah.
usage of steroid, because we know that
Yeah,
steroids
are
causes psychosis.
among the
Yes.
athletes
Among,
usually, yeah.
yes.
So now we have all the blood work done, investigations have been done. Check urine, very important,
Yeah,
right?
we
Doc?
check for
Urine, this is the way
STD.
I handled them when I was working. Check everything before I get the behavioral medicine involved.
I usually, well, those of us who have been trained over the years and in pediatrics, and I thank that I have been at Havewick for over 30 years,
Right.
I am
yeah.
accustomed to seeing these
See
type
all
of,
these things, right?
and I have listened to what the other psychiatrists do, and some of them I will ask them, Mom, do you want me to try and take care of it?
Right.
Since I am more familiar with this patient than a psychiatrist at this time. And I will start them on the appropriate medication for their anxiety. And if I see that it's beyond the bounds of my knowledge, then I refer them to the pediatrician.
No.
Because the parents are more trustworthy in me as a pediatrician
Exactly.
than someone else.
And you have built a good relationship with them
Relationship
also.
is the most
so
important thing.
Yeah, that is very important. They respect you, they trust you, and they know that you will do your best.
Yes.
So, Katrina, what do you have to add to this, what we talked about as pediatrician role?
Well, so I do agree with Dr. Thomas that the parents and even the patients like bring up their behavioral health or mental health concerns in primary care, then go to behavioral health medicine. It's just
Right.
because the stigma is there as well.
Very good.
That they don't really agree that there's something wrong with them. It's just attached to behavioral medicine that, you know, you go to a psychiatrist or a mental health
You're
professional,
crazy.
you're crazy. So they prefer going through their
Hard
primary
to say
care.
that you
Yeah. So yes.
You know, when I was doing all this research on this, and I have written some articles for Academy of Pediatrics and all those. The thing is, you know, there is so much has been mentioned in the CDC, World Health Organization. Everybody has mentioned about this whole thing because the later on, you know, this all leads to the most serious form, you know, like fire alarm, accidents, and suicide, all this.
Right.
So we have to, as a pediatrician and as a clinical, we have to stop everything, right? So it doesn't reach to that age. So do you agree with me, Don?
Oh, yes. And because the nurse also, they interview the patient. And a lot of times they are more accustomed, and they'll talk to the nurse more than the doctor at times.
Right.
And so we listen to what the nurse, because we work in a concert where a doctor alone cannot do this.
Exactly. And they have more time to spend individually, right? Like, you know, even as an adult, we go to the doctor's office, which is basically the clinical nurse practitioner. They are the one who do most of the elaborate history and all
Right.
that.
There are studies which are suggesting now that the nurse practitioners and the PA, that a lot of patients prefer them because they spend more time
They
with them
spend more
than the
time,
doctors,
right,
because the doctors are getting in and out.
Right, yeah. So after we are done with this, you know, like we also have to distinguish whether they have a autistic disorder, a spectrum, or whether they have a attention deficit. So we have some tests, right, that can be done, right, Doc?
Yes, there are tests that we do in autism. We think that it should be diagnosed before the age of 16 months.
Age of 16 months?
16 months.
Okay.
And with the help of the pediatric neurologist. When I see them, I do, because the mom will tell you, oh, Johnny doesn't smile as
Yeah.
his sister.
No, so
He
so-
likes to be alone. Yeah, he
Yeah.
likes. So with that, with a knowledgeable pediatrician, you have an instinct of knowing what to do, and you can do it, but you can get the help of your colleagues.
Right.
And we are seeing a high incidence of autism and ADHD because we're having more premature and babies living longer now. And so their brain is not developed as a normal
Right.
patient. And so
Right, right.
there's a higher incidence of autism in prematurity and in ADHD.
So for our viewers to know, Dr. Thomas has specifically said very important, autism spectrum should be at the age of 16.
Yeah, we like
or
for 16 months.
Yeah. That's how you catch them in the beginning,
In the
right?
beginning.
They cannot speak, they are alone.
And
No
so
eye contact.
And no, eye contact. That's
contact.
very important. And so treatment can be initiated
Right.
at an earlier age, and the outcome is much better if treatment
Right.
is
If
started earlier.
Earlier the better. What do you have? What you have to add at your end?
Yes, with like Dr. Thomas said, with autism, it does come with a lot of concerns with it, like with attention, learning difficulties.
Yeah. Right.
That's just what it is. But the earlier, the better. I agree.
Right, yeah. So once now we have distinguished between autism, autistic child, and all those eating disorder, then as a pediatrician, we advise them to
Yes.
do what we think is the best for them, right?
Yeah, we tell them that is a spectrum.
Yeah, it is
So you have one which is profoundly autistic, and you have the high functioning ones. And so it's not a stigma
Right.
because they are not the ones that cause it. Because a lot of people will say, oh, because the parents hasn't taken proper care.
Right,
Those are
right.
people without the knowledge of science. And you try to tell the mother, try to help her to do the best she can.
She can, yeah. And then the most important thing is advise the family.
Yes, it's a
Because
family.
if the family are together, they
Are
have
together.
a good cooperation. You agree with me, right?
Very
Doc?
much so. But we see because there's a high incidence of divorce
Exactly.
now, and one
Exactly.
partner will say one thing and the other will say, so they have to come in concert that they have the same behavior towards the child.
Right.
Because,
Abuse,
Yeah.
physical abuse, emotional abuse. I don't want to get through that because that itself becomes another topic.
yes,
Smoking, they get involved, especially
Oh,
the
yeah.
adolescents. They get involved with all those other things. Automotive accidents has been,
high incidence.
high incidence.
There are studies that showing that patients who have ADHD and is not on medication have a high incidence of abuse
High,
and abuse in car accidents.
right, yeah. But recently, doctor, I have been regularly watch the CNN and current CDC and all that. Now there is more drug issue among them, the fentanyl-laced
Oh, yeah.
drugs and all those. And this is entirely a different issue. But for the parents at home, just the advice that they should keep all the medicine locked, right?
Locked up, and any change in the behavior of the child, the patient, they should seek
Right. They should see and then, yeah. 'Cause-
medical advice.
Yeah, because nowadays the fentanyl-laced drugs, street drugs, they are being sold and then they get access to those. So now another issue, doctor, I'm going to ask you about what do you think about alcohol among them and how to
It has increased now, especially in the time of COVID. Patients looked at different things to do. And one of the things is drinking, vaping, and smoking.
Okay.
You see a high incidence of that. But it's apparent, as a parent, you should be concerned in all the different behaviors, the deviant behavior of your child. You are the leader in the home, not the child. So
Exactly.
if something changes, you should be there for that child.
Yeah. And smoking and vaping, that is
That's-
another big issue, right?
Big, very big issue.
Yeah. Because
And
of the,
we know of all the comorbidities that are associated with smoking.
Right.
We have a high incidence of patients who have asthma, and smoking
Yeah.
has a bad effect on asthma.
yeah, I used to see a lot of asthmatic, among these kids wheezing, and once they get better, then on further issue, then further asking question. Apparently, they are
They
vaping.
vape.
Because
Cigarette.
they do not think that it's completely different from smoking, and they don't have all the issues that smoking may present, which is
Yeah. So
completely
altogether,
false.
these are the important, pertinent finding questions that as a parents we should know. And raising a children is not an easy job.
Oh, yes.
Right?
I agree.
But it was a choice,
Yeah.
I agree. Yeah.
and you have to do what is best for you.
What is the best for them?
Because they are the future of our great country,
exactly.
and
Yeah.
we have to do the best we can.
Yeah. What do you have to add there?
So with the vaping, I agree. A lot of parents are misinformed. I see it in the inpatient hospital, psychiatric hospitalizations. They all come with a vape at 12, 13, 14
Yeah,
year
right.
old.
As early
And the
as
parents are okay with it because they think that there's no nicotine in it and it's not as addicting, or they don't get the what Dr. Thomas
because they
mentioned.
want to see their kids happy, right?
Yes, but they don't understand that it's the same as smoking. So tobacco, I mean.
Yeah,
But,
right.
yeah.
Smoking and the drugs. Now that
Yes.
this has become like number one suicides with the drugs. Now this is the number one cause of death among those
Yes.
adolescent and
Even
it is high,
marijuana
right? I saw
is
the
laced
curve,
with-
of the
Fentanyl.
fentanyl is number one, and then that's how they have Narcan and everything stored at the school.
They do Narcan trainings in the school.
Yes,
Because
yes.
of the overdose
Yes.
and fentanyl and, because marijuana
Yeah. Marijuana
is
that's
laced
another-
with fentanyl. Yes, I know. It's a lot.
We can sit here and talk forever about all these things going on,
I
with all
agree.
this. But now they have also come out with a nasal drop of Narcan. Did you notice that? They just
think-
came up. The paramedics.
I do.
I just took my ACLS research, and the paramedics they have the saline drops, nose drop with the Narcan, naloxone. So many things happening. So now, what would you last minute advise? What would you advise as a pediatrician to the listeners, the parents, the children, whoever are listening to this talk?
Yes. I think that in this society, we have to get accustomed to the different behavioral pattern and different
Right,
disease that we have. And we should not tend to criminalize patients with psychiatric illness, because the only thing that will make the society better is helping others. It is suggested by the great writer that the happiest people in the world are those who do most for others. So I would think that everyone is your neighbor.
Right.
And if you can make someone's life a more business of delight, then your life will not be in vain.
And they are our future
They're
the
the
kids,
future
when
of
they
this
are on the
country.
right track, when they're basic education, good habit. We haven't touched the nutrition part.
Well,
There's so much to talk about that also, right?
well, we did about obesity.
Yeah,
And,
nutrition.
and that's
Proper diet.
Proper diet. And one thing I would like to mention that a lot of pediatricians may not know that patients who come in with frequent vomiting, they have to think about marijuana.
I was going to ask you that question. You cut it out of
about
me.
marijuana. There's in the studies that there is vomiting associated, persistent vomiting associated with the chronic usage of marijuana.
Oh, okay.
I had a patient at the psych hospital the other day, and this was what was happening.
So the vomiting is a manifestation of
A complication.
overuse of marijuana. Now they have legalized it too.
Yes.
Right. So what are we going to do? We are going to, there's a big dilemma.
It's a dilemma.
What are
Just
we
like alcohol and tobacco, but
alcohol, tobacco, and so that's very good. How about Katrina? What do you have? 1 minute, your advice to our listeners.
Well, with anxiety and depression, if there is anybody who needs help, like the children, like the parents or grandparents just need to be aware of the
Yeah,
signs
right.
and symptoms, any change of behavior, don't hesitate to seek help.
Right.
There is available
Open up.
help. Yes. And, try to minimize the use of devices and just watch your kids. Make sure that, their environment, who they hang out with, it affects everything, and, seek help if needed.
Yeah.
very good.
So the most important take-out message is seek help.
Help.
Open up and seek help.
Help.
Right, Doc?
Yes.
Seek help, whichever way you can get, right? So that's very good. I like to thank both of you, Dr. Kingsley Thomas and Katrina Sanchez, for coming to my show, Health Talk, and our topic was anxiety and depression among our school and college students. Because these students, they're going to the college,
Yeah.
starting from, so they should get rid of all this issue before they start a new
Right.
life, right? I'd like to thank our producer for helping me produce these tapes. And until I see you again, have a very safe and a wonderful spring and summer. Thank you again.
Thank
Thank
you.
you again.